Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO at Zest Dermatology, Ray Costantini. Did I say it right?
Costantini.
Costantini. Boom. You heard it here. I got the lesson. I said it right the second-ish time. And now we're laughing. We're off to the races.
One too many syllables, man. That's the way that it works. So
I was telling people, I'm like, recording with Ray Costantini, and I said it like 6 times. They're like, "There's no way there's like 8 I's in there." But I'm really excited, Ray, to have you on. Had the opportunity to actually be connected with you. It's been a couple of years. I heard you speak at the M Health conference that like the World Congress organization, whatever, put on in Boston.
that's right.
Before anyone was talking about like telehealth and virtual care, and it was you. Roy from Amwell was there, as well as Recovery Health Solutions. There was a couple, like there was like 5 or 10 companies there, and it's interesting to see all these conferences get built on it, and all this conversation happen and the growth. But really excited to have you here today. Would love if you could start off by telling the audience a little bit about your background.
Yeah, happy to. So lightning version on my background, physician, healthcare executive, healthcare entrepreneur. I've worked at large healthcare delivery systems, mid-sized health plans, started several companies. The one before Zest was called Bright.MD. I think folks may be familiar with that, pretty successful company. And I think the connection with all of those is that I have found myself consistently drawn towards things that let me work to be able to make healthcare better, to make the process better, and to do that not in an incremental way, but I like rethinking how some of the big pieces fit together, and then innovating around how it could be improved for all the people that are involved in it.
And let's dive into your latest venture, Zest Dermatology. Give us an overview of really the company, where you're at today, and what excites you about this new venture.
Yeah. Well, Zest Dermatology is a virtual tech-enabled clinical services company. And that's the boring version of it. The exciting version of it is we've got a huge number of patients, almost 50 million patients in the United States who are suffering from eczema or psoriasis. And the experience of care that they've got is pretty miserable. The conditions themselves are really difficult. I don't know how much familiarity you've got with this, but I mean, they are really not only physically uncomfortable, but they can be disfiguring conditions. They carry a huge emotional burden with them. They can be really difficult to treat. These are systemic autoimmune conditions that are really impactful, increase the risk of heart disease, increase the risk of depression, social isolation. They're tough diseases to be able to have. And these patients really don't have a great home. So if they're being seen by a primary care provider, primary care providers are good at managing long-term care on chronic diseases, but they don't have a lot of depth of expertise in dermatology. And if you see a dermatologist, dermatologists generally do most of their care around what we would call episodic or procedural care. They're focused on fairly short periods of time. A typical visit with a dermatologist is about 3 to 5 minutes long, and you see your dermatologist maybe 2 or 3 times a year at most, and that's if you have a pretty complicated condition. And so these patients aren't getting the kind of support and care that they really need in order to be able to manage these complicated conditions. Lifestyle coaching, as an example, happens in about 1% of derm visits with an eczema or psoriasis patient, and those are the kinds of things that these patients really need, and that dermatologists aren't equipped to be able to provide. And so our ability to be able to come in and to bring a comprehensive set of care services, including medical dermatologists, um, derm specialty nurses, health coaches, and to be able to bring that package to patients is a really exciting thing that's what really drew me to this, and the ability to be able to do that in a value-based way that kind of divorces itself from the traditional fee-for-service model of care made it that much more exciting.
And how has that your past experience in growing, building Bright.MD, how do you think that experience will help you in scaling this venture?
Um, there's a lot of things you learn here in the process of building a venture-backed company that makes additional venture-backed companies a little bit easier. I think one of the things that specifically Bright continues to do really well is use technology to make the care delivery process more efficient. Part of the reason why patients only get to see their dermatologist after a 3 to 6 month wait, and they only get to see them twice a year, is because there's not enough derm provider capacity out there to be able to serve all of patient needs. And so, the same way that Bright.MD was able to make the care delivery process much more efficient for urgent care type conditions, Zest is able to bring that same kind of an approach to dermatology so that we can make it so that patients can get seen in 48 hours from the time that they are seeking care. And we can make it so that instead of getting seen twice a year, you get seen twice a month if you need to, in order to be able to manage your condition.
And in terms of, I know there's a lot, happening, right? But in
Mm-hmm.
terms of what's next for the company, what's really exciting to you? What are some of the things that we can expect to hear about coming up? You don't have to give us everything, right? But if there's anything you can share with us here today, we'd love to hear it.
It's a really exciting company. So you're asking me to pick from a whole lot of different things, but um, our availability is a huge thing. We're now live and available to patients. 60% of the U.S. population now can get care through Zest. That's 35 states, and we expect to be in close to 90% of the U.S. population by the end of Q2 of this year. And so that's for me, that's really exciting, and hopefully that's exciting for patients. We're talking more and more with health plans about how we can be partnering with them to be able to make the care more accessible and affordable by working with the payers instead of having to go only direct through patients. So both of those are pretty big and exciting developments that I think are worth sharing.
Well, we're really excited to continue to see the progress of the company and to stay in touch with you. Hopefully, we can have you on a panel. Maybe we
Yeah,
can do like a dermatology focused panel where we talk about kind of what can we expect in the industry, what's exciting, what still needs to change, maybe on the regulation side, which is always interesting to
yeah.
throw in some questions there. But what I want to, again, thank you, Ray, for joining me on the podcast today, sharing your story, diving a little bit more into Zest Dermatology, and I look forward to staying up to date on what's happening and then having you come back on again real soon.
I appreciate the invitation, Jared, and it's always a pleasure talking with you. I'll look forward to the next chance to continue it.